Hello, everyone. Welcome to our Zoom meeting. Today we will have a couple of topics, and Dr. Huyam and her team will be presenting. So, hello, everyone. Welcome to our. We'll start with the agenda. As you see here, there is dizziness, surgical, and word of wellness. All these topics will be discussed. And I'd like to welcome all the new fellows. Welcome to the program. So without ado, I'm going to hand it over to Dr. Liam and your team. When you are ready, you can just start.
Hello, Dr. Nader. Hello, my colleagues. Thank you very much for this great opportunity that expand my experience. And thank you, my teams, for be flexible and ready for presentation. Thank you for everyone who joined the meeting. So we will begin with Dr. Sana. When you're ready, you can share your screen. Thank you. Dr. Sana?
Yes, I am ready.
Yeah. Go ahead.
Okay. Hello, everyone, and I want to thank Dr. Nadir for giving us this opportunity to build up our future, inshallah, and thank you for Dr. Huyam to contact me and work as a guide for me through this presentation. This is my first presentation, so I start with the dizziness in elderly. My agenda will be a definition of the dizziness, pathophysiology of dizziness in elderly, the prevalence, classification and causes, and treatment and faith. I hope this will be not very long and go spontaneously, inshallah. So we start with the definition of the dizziness. Dizziness is a feeling of lightheadedness, weak or unsteady, like the world are spinning around you. The most common, the prevalence of the dizziness is in older adult is about 4 to 30%, and chances increase with age, more common in women than men, and it is a more than 50% of cases have multiple causes. So it is a multifactorial. The age change related to the dizziness in elderly, the pathophysiology of the dizziness, the underlying cause, as I said, is a multifactorial, and there is will be imbalance caused by change in many factors associated with the balance system, sensory, visual, and vestibular, and neurological and muscular origin in the elderly due to physiological change with age, and also due to the deterioration with age. So decrease the visual due to presbyopia or cataract, decrease in the vestibular system due to hair loss or hair cell loss or neuronal loss, and decrease in somatosensory. All these factors contribute to the decrease in the CNS and neuronal loss and lead to deterioration in the physiology of the musculoskeletal symptom and increase the chance of the dizziness and fall in the elderly. The classification of dizziness, they classify dizziness as acute or chronic, and acute dizziness in elderly, it is independent on age. In general, it is independent on age and usually occur as acute and usually result from a disorder of one system and most common due to acute vestibular neuritis and hypotension, hypoglycemia, dehydration, cardiovascular ischemia, and cardiovascular disorder in general. The chronic dizziness, more common in elderly, this our part, and ongoing from 1 to 2 months, has multifactorial etiology, and the most common cause is hypertension, anemia, and anxiety, medication side effect, memory disease, and benign paroxysmal positional vertigo due to disturbance in the vestibular system. So I will go over some of the risk factors and I will mention some treatments. Dehydration and hypotension is an important risk factor for dizziness and in elderly. So it will be due to reduce the thirst sensation or the mobility limitation, or increased fluid loss due to sweating, diarrhea, or excessive urination, and or due to cognitive impairment, or as I said before, due to drug. So I think this is, I will go back to this one. Sorry for that. So the pathology of benign paroxysmal positional vertigo is one of the common cause of dizziness in elderly. It is due to displacement of otoliths from their normal location in the inner ear, and it is treated by Epley maneuver, and this maneuver help to reposition the otoliths in the inner ear. Anemia is other cause of dizziness in elderly, and anemia tend to be due to nutritional deficiency or chronic disease, some medications, malignancy, or blood loss. Hypoglycemia is the other cause of dizziness in elderly, and it can be simply due to decreased food intake, diabetes, some medications, treatment, educate the patient about how important to take regular frequent meals and avoid strong hypoglycemic agent, and treat the underlying cause of the hypoglycemia. Now we will go for the complication of dizziness. One of the most common complication of dizziness is a fall, and complication related to the fall, loss of independence because fear of dizziness and fall, and reduced quality of life, increased health care cost. I will go to the fall slide again. Fall is a most common complication of dizziness in elderly, and fall it can be due to the dizziness due to multifactorial, like I said before, due to decrease in vertebral function or decrease in nerve conduction velocity, due to musculoskeletal change and decrease the sensory system. Now I will go to the treatment of the dizziness in elderly. It is like a brief treatment option. So the prevention is most important thing, and regular follow-up visit, prevent fall by the all measurement like regular checkup for the eye, ears, and musculoskeletal system, and exercise program. Regular meal and hydration by educate the patient, help the patient to manage the meal preparation and give him like or her education about the importance of the hydrations, avoid unnecessary drug in elderly that can cause dizziness, and treat the underlying cause if there is any like chronic disease, anemia, or hypertension, or any other cause of the disease. This is my presentation today. Thank you and best luck, and thank you for the opportunity.
Thank you, Dr. Sina, for nice presentation. If there is any question about or there is a point it's not clear, you can ask it about it. Feel free and ask. Or we can write it in the chat box.
Thank you so much, Dr. Sana, for great presentation. And it's an important topic because it's common. And when you treat older adults, you think about it. And as Dr. Sana mentioned, it contributes to falling in older adults. So you need to ask some questions about that. I'm opening the floor to see if any one of you want to share any experience with treating patients with this condition, and how did that go? Not necessarily in oral adults.
I can share my story, but I wasn't contribute in the treatment. It was my dad. He passed away, Allah yarhamhu, and the fall. He has multiple issue, and he was able to standing, but when he fall, he broke his femur, and this has totally changed his life and deteriorated his quality of life and affected him like strongly emotionally, and decrease his fighting to against the disease. So I think it's very important to care about the fall. It is the most important complication we have to take care of in the elderly with disease.
I'm sorry for your loss, Dr. Sana, and thank you for sharing your experience and story. Anyone else?
Hi, sorry Sana for your loss. Allah yarham ويغفر له. Yeah, I'm
Thank
working at patient care tech, also at University of Iowa Hospital. We have the cancer patients, most of them are elderly. So last week we have one of our patients fell down and he broke his arm. So and this breaking his arm because he have his lymphoma also, like brain lymphoma. Together, all together, he's so confused and he's delirious. And he ended going to the ICU.
Thank you, Dr. Fatma, for sharing your experience as well. Dr. Ranim, please go ahead. You can share your comment. Okay, let me read the chat here. So Dr. Rini mentioned the importance of differentiating central versus peripheral causes. So when you take history, when you do the exam, and when you order some diagnostic tools like labs or imaging, you want to think about that as well. Dr. Maram, go ahead.
Hello, everyone. I'd like to share a personal experience. A family member of mine had dizziness for a period of time, and she was misdiagnosed with Meniere's disease. She was started on beta histine, and she took it for a while, and it didn't seem to be working. So I sat with her, and after taking a thorough history, I suspected the benign paroxysmal vertigo. So I started her with we tried the Dix-Halpite maneuver, and it seemed to work. We did it multiple times, and she, alhamdulillah, improved. And this confirmed that she was misdiagnosed with Meniere. So we continued on that, alhamdulillah. So the point I'd like to raise here is that it's very important to take a thorough history so you can differentiate between different causes that can be very similar at presentation. And thank you so much.
Thank you so much, Dr. Maram. And again, both Maram and Renim highlight the importance of finding the differential diagnosis and pinpoint the cause. So it's very important to take good history and good examination. And sometimes the treatment might be simple. I'm going to share the screen here. And this is one of the treatment, like exercise treatment, that can be offered to patients with dizziness due to benign positional vertigo, for example. So I'm going to just, let's see. Can you hear the sound?
Normally, only with head movement does fluid within the inner ear also move,
Yes.
informing the brain that a head turn occurred. However, should a crystal called an otolith gets displaced into the posterior canal of the inner ear, BPPV dizziness occurs. Fluid movement occurs due to the crystal rather than head turns, causing the brain to think movement has occurred even though none has happened. The Epley maneuver is performed to treat this posterior canal BPPV by trying to get the loose crystal out of the canal. This maneuver is started by turning the head 45 degrees and the body laid back such that the head is extended about 20 to 30 degrees. If BPPV is present, eye twitching called nystagmus will occur. After 30 to 60 seconds, the head is turned 90 degrees to the opposite side and held for another 30 to 60 seconds. The head is then further rotated another 90 degrees, accomplished by having the patient turn onto their side, which is then held for another 30 to 60 seconds. At this point, the head should be turned 45 degrees from the horizontal. When performing this maneuver, another individual can help with these position changes. The maneuver is then completed by having the patient sit up. So what's going on with these position changes? Essentially, the head is moved in such a way to manipulate the crystal to fall towards the canal opening. With each position change, it takes about 30 to 60 seconds for the crystal to settle into the most dependent position in the canal. If turns are made before the crystal has a chance to settle, the crystal may fall back the wrong way and the maneuver will fail. It's also important that the head positions are angled correctly, or else the crystal will not settle to the correct position in the canal and the maneuver will fail. Also, if the position changes are done too slowly, the crystal may not settle quickly enough from lack of momentum and the maneuver will also fail. Once the crystal falls out of the canal, the dizziness should resolve if due to posterior canal BPPV.
Thank you so much, all of you. And this maneuver is simple as you saw, and it can be done in the clinic or at the hospital or at home. You can teach your patients to do it, and they can get some help if needed. So sometimes it fails, but you need to repeat if that's the case. And as mentioned, take your time, make sure it's done the right way. Thank you again.
Thank
If
you,
no more-
thank you. Yeah.
Yeah.
Thank you very much for that video. Dr. Marwa, do you have any questions or adding any information? You are still handing your up. Dr. Marwa?
I think she just left the hand over, but you can go ahead.
Yeah. We can go to the second agenda, which will be presented by Dr. Ines. Dr. Ines, are you ready?
Hello, everyone. Is my
Hello.
voice clear?
Hello. Yeah, it's clear. How are you?
Okay, so alhamdulillah, I'm very good. I hope everyone is doing great. So today's presentation, inshallah, I'll be presenting on physicians' well-being. So I'll be sharing my screen. Can you see my screen? Is it obvious now?
Yes.
Yeah, it's clear. Yeah,
Okay,
go ahead.
that's great. Okay. So starting off with residents' well-being, this presentation is going to guide us and to let us thrive through the process or through the journey of residency. Okay. Starting with some statistics. So a survey was conducted in 2023 regarding the burnout. They wanted to see the rate of burnout among resident physicians. It was about 42.5%. It also depended on the specialty. So we have the most specialty that has a lot of or a higher rate of burnout. These were internal medicine, 63%, neurology, ophthalmology, dermatology, general surgery, and psychiatry. Okay? So the reason why I mentioned the statistics is for us to understand the burden of burnout itself and to find solutions and to find ways in order for us to navigate and thrive through residency. Okay, so starting with the three pillars, we're going to focus on emotional well-being, mental, and physical. Starting with emotional well-being, so emotional resilience is something that is very important for us to build before residency. Starting off with recognizing and processing emotions. So the thing about recognizing and processing emotions, a lot of people, they are not honest about their emotions. We're not honest about whether it's fear or self-doubt or inadequacy. These are all normal, but we don't usually recognize them. So instead of resisting these emotions, we should acknowledge them. It's okay to feel the fear in our body. We should not suppress these distressing emotions, but instead we should find proper outlet for these emotions. Managing stressful thoughts. So there are a lot of techniques for us in order to manage stress in a healthy way. We have one of these is actually the box breathing. So the box breathing technique is very effective. You can do it anywhere you're at. It's very simple. It states that we should inhale for 4 counts, take a deep breath, 1, 2, 3, 4, hold it for 4 counts, and then exhale it for 4 counts, hold it again for 4. This process is going to let us sense this level of calmness. It will allow us to feel our emotions. And while we're doing the box breathing technique, you'll be able to see or to observe your body and the reaction of your body towards stress. When you observe the palpitations that you're having, the sense of stress is going to, this is going to lower your levels of stress through the box breathing technique. This is the first technique that you could use. Another thing is maintaining a spiritual habit. So we need to stay connected with a higher purpose and connecting our journey with a higher purpose, whether it's through religious reading or whether it's through meditation, finding Tai Chi, or whatever it is, whatever spiritual practice that you could do. This is going to help you throughout the process and the journey. Next thing is avoiding toxic positivity. So a lot of people, or a lot of times, we try our best to be positive, but on the way, we forget that these emotions are supposed to be out. These emotions are supposed to be expressed, and false positivity can be very harmful because residency is actually difficult, and ignoring these negative feelings, it's not going to help us, but instead it's going to harm us more. So instead of forcing ourselves to stay positive, we should focus on being real, we should balance our emotions, and we should be aware. We should be emotionally aware about our emotions. Next thing is surrounding also ourselves with people who would lift us and not drain us, because at the end of the day, our thoughts actually create our reality. So we should be very mindful about the energy that we put or that we let inside. This is regarding the network that we should be building. Now, next is the mental well-being. So going to a new hospital or a city or a culture, this can be very stressful to a lot of people. The thing is that we should see similarities even in any unfamiliar place in order to reduce our loneliness and build a sense of belonging, a sense of connection with any other person that you see. So every person that you see in front of you is probably going to remind you of someone back home. And the sense of connectiveness and the sense of relating to other people, it would reduce our loneliness. Next is categorizing relationships. So we should identify those people that you go to for fun, those who you seek advice from, those you could vent to without any judgments. So categorizing our relationships, whether it's friendships or partners, it's very important. And if you have all these characters, if you have a person who would bring you joy, offer advice, or provide a safe space for you, this is a treasure that you should always cherish. Next is also overcoming imposter syndrome. So while getting matched into the program that you desire is something that everyone else aspires to do and a dream for many, the sense of imposter syndrome will never leave a lot of people. That's why it's very important for us to keep a list and to keep scores of our achievement. So it's very important to remind ourselves of our past achievement. And if self-doubt is recurring, we should always challenge these thoughts. So we should always think about, when did these thoughts started? Whom did we listen to, or who told us that it was actually a possibility that we could fail? And we should replace these emotions, or replace these thoughts, the negative thoughts, with facts that we've already done a good job so far. We should also have something that is called the happiness list, or the list of joy. These are things that we could write down whenever we're in a low mood, because your brain is not going to be able to list things. It's not going to be able to let us out of this low mood. So we should always keep a list of joy, things that you should enjoy, things that you could go back to on difficult days, whether it's a hobby or a certain genre of movies, or things that uplifts you. So these are all important. Last thing regarding the mental health is reframing the residency experience. So residency, while it's very challenging, we could compare it between other things that are actually hard in life, which will give us a sense of freedom. So we could say, like, residency is challenging, yes, but so as working in an underpaid or unpaid, unstructured environment. Residency is exhausting, yes, but so is staying in a situation that does not help us grow. So every path is actually hard, but at the end of the day, we should choose the one that leads us to grow. The last pillar is physical well-being. So in physical well-being, the most important thing, of course, sleep, prioritizing sleep as much as you can, and accepting low days. It's very important for us to accept that not every day is going to be as planned. The sense of letting go, and letting go of control itself, it's going to be very relieving, and gives us a sense of freedom, of letting go of control. And last is actually using comedy as a coping tool. And that's it for residents' well-being and thriving through residency. Thank you.
Thank you, Dr. Ines, for nice presentation. And if there is
You're
any
welcome.
question for Dr. Ines, or adding any suggestion, or you can share it with us.
Thank you so much, Dr. Ines. This is great presentation, and again, this is important topic. Hopefully in the future, you will know how to handle stress and stressful situation, and how to survive during these difficult times. For example, the first year in residency, usually it's a difficult year, but if you have a net of support, if you have this type of skills we just mentioned, I think you will be fine. So just keep that in mind. Thank you.
You're welcome.
So we are going to the last agenda with Dr. Aziza.
Yes, Dr. Hiam, I'm here.
Yeah, thank you, Dr. Aziza.
Okay, I'll share my screen right now. Okay, is it obvious?
Not yet.
Okay.
And Dr. Aziza, do you need any help with the file?
Okay, I think I just found out what's the problem. Just give me 1 second.
I'll show you.
Okay. Just give me 1 second, I'll fix it. Okay, I don't know what's the problem. It's refusing to share the screen.
Do you mind sharing the file in the chat or by email, maybe? Doctor.
Dr. Hiam, you already got the file, right?
Okay. Let me, I'm using my mobile. Let me open the laptop and share from laptop. Okay.
So while we are trying to fix this presentation, I'm gonna share with you one of the
Just 1 second. Yeah. Is it clear?
Yes. Okay, greetings everyone, dear respected fellows. This is Aziza El Seed. I'm presenting today about the surgical laser scar removal technologies. Next. Okay, this is a brief introduction or a breakthrough about the surgical scars. Surgical scar is a natural part of healing process, but what if I told you that laser scar technology is highly revolutionized scar removing, making it faster, more effective, and virtually painless? Meet the advanced laser treatments that are transforming how we treat post-surgery scars nowadays. Many studies, the most current one, shows that the laser pre-treatment of the skin that can increase the permeability and the depth of penetration of topically applied drug molecules like corticosteroids and whatever. Next. Precision laser technology. Precision laser technologies have revolutionized as a treatment of surgical scars. Targeted approach laser deliver focused light energy to the scar tissue, stimulating a collagen, remodeling, and promoting skin resurfacing. This precision minimizes damage to the surrounding healthy skin. Versatility, laser can address a wide range of scar types, including hypertrophic, raised, keloid, raised, and extending beyond the original wound, and contracture tightening scars. Fractional laser therapy. This technique uses microscopic columns of light to target specific areas of the scar, promoting healing without removing the entire top layer of the skin. Combination treatment laser can be combined with other therapies like microneedling of the radio frequency to further enhance scar reduction. Next. Okay, the benefits of scar laser treatment: improve scar appearance, reduce the scar size and thickness, enhance skin texture and tone, minimal downtime, and long-lasting results. Next. Okay. As you know, laser treatment of a surgical scar is a non-invasive intervention. So targeted energy laser deliver focused light energy to the scar tissue without significantly disrupting the surrounding skin. With this contrasts with traditional surgical scar revision, which involves cutting and removing of the scar tissue. Minimal disruption. While some laser treatment might cause minor redness or swelling, they don't typically involve incision or sutures. Stimulating natural process. Laser works by stimulating the body's natural healing process, such as collagen remodeling and new skin cell growth, rather than introducing foreign substances or physically altering the tissue. Types of laser treatments, and there are none which are non-invasive. Ablative laser. This laser removes the outer layer of the scar tissue. While they do remove tissue, they are still considered minimally invasive compared to traditional surgeries. Non-ablative laser. These lasers pass through the skin without removing the outer layer. They stimulate the collagen production and promote healing from within, making them truly non-invasive. Next. Okay, all these treatments are safe and effective. Targeted approach laser precisely target scar tissue, minimizing damage to the surrounding healthy skin. Minimal disruption. Most laser treatments are non-invasive or minimally invasive, reducing the risk of complication associated with traditional surgery. Customization. Dermatologists and plastic surgeons can adjust laser settings to suit individual scar types and skin tones, further enhancing safety. Common side effects, some redness, swelling might occur, but these are usually temporary. Effectiveness of laser treatments improve appearance. Laser can significantly improve the appearance of the scar tissue by reducing size, thickness, and discoloration, enhance skin texture. Lasers stimulate collagen remodeling, leading to smoother and more even skin texture. Long-lasting result, while complete scar removal might not be possible, laser treatment can provide long-lasting improvement. Important consideration before considering or before choosing laser treatment to treat your scar type. The effectiveness of the laser treatment can vary dependency of the type of the scar. Skin tone. Some laser types might not be suitable for all skin tones. Multiple laser sessions might be needed to achieve the optimal results. Okay. Disclaimer, while laser scar treatment are generally safe and effective, it's crucial to consult a qualified dermatologist or plastic surgeon to determine the best approach to specific scar type and condition. Customization. Factors considered for customization. Scar type. Different scar respond to a specific laser type and setting. For example, hypertrophic scars might benefit from laser that target blood vessel and reduce redness. Keloid scars might require laser that breaks down excess collagen and flatten the scars. Contracture scars may need a laser that release tension and improve flexibility. Skin tones. Some lasers are more suitable for certain skin tones to minimize the risk of pigmentation changes. Scar location. Okay. The scar location. Can you go back, please? Scar location. The location of the scar might influence the choice of laser and treatment approach. For instance, scars near the eyes might require extra precision. Individual needs. Factor like pain tolerance, downtime preference, and budget can also play a role in customizing the treatment plan. Okay. Laser type selection. Dermatologists, plastic surgeons have access to various laser technologies, each with unique properties, and they can choose the most appropriate laser for the specific scar and individual characteristics. Permanent adjustment. Laser settings like wavelength, energy level, pulse duration, and spot size can be adjusted to fine-tune the treatment and optimize results. Combination therapy. Laser can be combined with other scar revision techniques such as microneedling, radiofrequency, or injections to enhance the overall outcome. Treatment schedule. The number of laser sessions and intervals between them can be customized based on the scar severity and individually responses to treatment. That's all for today. These are the references that I got this information from. Thank you for your listening. You have any questions?
Thank you, Dr. Aziza, for nice presentation. That's If there is any question or adding any appointment or information. Yeah, Doctor, you can go ahead.
Yeah, my question is that helpful on tattoo removal and recovery.
Sorry, didn't get your question.
Is the laser helpful for remove tattoos for people that they want their tattoos to be removed?
Yes, it's the most prevalent way to remove the tattoos, especially the long-lasting one. Like if you have tattoo for years, like 2 years, 3 years, is the best way to remove the tattoo is to have laser sessions. It's about 4 or 5 session maximally. It might be painful. This is just the difference between the tattoo removal laser and the other laser. It might be a painful process, kind of, but otherwise it's cost effective. It is it's very fast. Okay, it doesn't take a lot of time to heal.
Go ahead, Dr. Wafa.
Yeah, I was wondering that laser for dark colored skin. I know laser can cause hyperpigmentation. Which type of laser is more suitable for dark colored skin?
Most likely the non-ablative one, or if the doctors choose to do ablative one, it's like about the energy, the frequency, okay, he using for the type of the scar, okay. Because if I used a non-ablative, it's safe, but if I use it with a very high energy and a very high frequency, can cause a lot of pigmentation. So it's not only about the type of laser, but also about how to use the laser.
Thank you.
Once again, thank you so much for great presentation. Any other questions or any other comments? If not, we can move on to another agenda in the item. Dr. Mohammed Al-Hussein, he will present about the Canva and how we can use this tool. When you are ready, Dr. Mohammed, go ahead.
Thank you, Dr. Nader, for the presentation. We will be happy to present today Canva timeline infographic design. I will just share my screen. So for the designing the timeline infographic, we have two options on the Canva. It's great tool. I just discovered it yesterday. So either we can just if we did like for me it's my first experience, so I did like go for template, and then on the search you just enter like timeline infographic design. Uh, Click on, so it will give you like a lot of options. Some options here they request that you you can customize immediately. So that is okay. I can go and start to work on it. Others, they request that you have a subscription with Canva to have access to it. Uh, for me, I did this one. So you can go after you have that template, like it will be different subject. You just need like the designs that work with you. Then you can start editing the name of the template. I did uh, I did it from here, like I did the step two timeline pathway. For me, you can just make it bigger or small according to what you preference. So I start like actually this is the template. It's for like American history, and I just make the change to make it for step two. So it's from history to go for exam. So you just like usually double click in what you want to change, and then you do what you want. Like you can change it for 2025, other where you like it. Uh, then you can go for design if you want to change the design. You can add it. Then for elements, you can go. You can add lines, arrows, shapes, graphics. If you want to add some graphics, it will give you like options for graphics you like. Just you change the search icon, like I can search for horse, for example, or brave man's. Then you click enter, and then it will give you like, and then you just like click and take it to where you want, and then you just work in it like to make it fitting the area you want them to have it. For the old one, you just you click in the frame, and then you do like delete, and it will delete it for you. Uh, that is like now I just delete mine, then I can go put it like here. So working to make it fit for the place I want. And also you can just like go back if you didn't like what you did, and then you can start rework again on the design. Uh, uh, from elements also you can use like which you like to do. Uh, you can also go like if you didn't find your option, let's see for elements, and then go for search like for, or you can go for design, search for like photos or anything you like it, and then you add. Also, this for the, sorry, this for the ones that I will create it by my own. Or as here you see like generate your own image, so you can create like just put like any word you like so like educated study, um, yes or no. student, and then you click in and it will start to search for you, like to find suggestion for you. Can use also graphics to do that. This is the first option. You go just change like the paragraph you want, and then like you just double click to change the word from the template. Then after you did that, you can now either share. So if you wanted to share it, like you can add the people you want to share, like I can share it for my email, or you can download it if you want. So like you want to download it, you can go and download it. And it's great to like for me, like just putting times frame and make sure like I'm following this. I can put it like as Dr. Inas said earlier, like something that encourage you and make your motivation be better, like for the study plan and for uh, like that. The second one, like if you want to do your own, you either like any templates available, you should go for home and then you create your own design. Again, you just write like timeline, infographic. You just need this one, timeline infographic. It should give you blank. Then you go for elements and you just go and for rate that you want to your design to be, and then you can choose any of these grades. It's just like these photos, like I can use photos, and I can use like grade itself. Later on, I can remove the grade after I'm done from my design. Then like I can use line, do the like your study line or like that. So I can make it longer, shorter, straight, uh, vertical. It's on your option. Then you can insert like uh, columns. So you can add columns if you want to like just go and then like double click on the to have note on it. Okay, align to the page. So like I can align them, and then I can have these options like copy them, paste, duplicate, or if I'm not like it, I can delete it. Uh, then I will head back, and then I will go for text. I can then start at heading, so I can write like, for example, step 2, exam time fine, and then I can add subheading. And can I put like something motivating sentence or like that? Uh, I can add another page if I want. Uh, then I can even like if you like to draw, you can just make your draw. If you're writing it, like I can start writing. So like it's to like to have writing or that. Uh, Still on text you can find like uh when you use Magic Write, but I think for Magic Write it's just you should have a subscription with them. It's pay for, so you should pay. I think like subscription each month. Uh, then you can go work for Element. Definitely can add photos. So just you put like for example, I searched for your word photo, but I couldn't find it. So like it's over here. So and usually I can just go take it down here, and then we just will go for the all timeline. My design for today was like so I did this one from templates that is already been. So like you should have passed step one before you go for step two. You should start with your U word plus first aid, and just I put comment here. Enjoy type with knowledge of being future physician better cover you. Then like I put like it if I planning to take it on May. I put like I will start my dedicated period in April 2025. So still you see like here I didn't change it, so still it's from the old template. Same here, self-assessment exam start. Don't be like I could just use logo and be upset by performance. Look to your weakness and try to improve between each test. And then reload your knowledge. Use other source of information like campus, inner circle, circle, and podcast. And then you took your MBME exams. Uh, Doing the online, and then it's just enjoy the day of the exam. So this for me like I will go finish some and then I will put it in front of me to be like my encouraging notes. Uh, and this what I start to do for step two, like this is my own template. So this so once that I design it, still I'm working on it, like highlight activities needed for the exam. So this step was success, and then uh, looking forward for the step two. That is all for today. Thank you. I'm open for if you have questions.
Thank you very much, Dr. Muhammad, for nice presentation. And
Thank you so much, Dr. Muhammad, for sharing this skill or this tool and the tutorial, how to use it. Thank you so much. This is very helpful, and I hope it will help some of you down the road. And maybe you can also teach others during this period while you are in our program. But thank you so much for sharing this tool and how to use it. Thanks.
Welcome. It's a very enjoyable. Like I feel like when I have the project name in the first, like it's too hard to use, especially like when it tell you like graphic design and everything. Like it's far away from medicine. But like I think Canva is very useful. Thank you for having us and introduce us to these tools. I appreciate it.
Thank you so much again. So, and I want to highlight one point. So this program is an opportunity for you to practice, to improve, to learn more skills. And I want you to volunteer and take a step farther than what you feel comfortable with. Sometimes you may think you cannot do it or intimidated by the topic or by the short time notice if I ask you to volunteer. But as Dr. Muhammad did, so I asked some group to help me for this presentation today, and he volunteered his time and practice. So sometimes it may take you a few minutes to familiarize yourself with the presentation topic or the agenda item, but maybe you can use some of the tools available. So nowadays we have the AI, the artificial intelligence, and they can write a whole topic for you, a whole presentation. So if you want to start with a new topic for you, you can ask either Google Gemini, for example, ChatGPT. Nowadays, there is a DeepSeek and others that you can use as tools to generate content. So you can ask with a prompt to write the topic for you. You can start with writing the outline and then ask the AI to write the slides for you, and then you can move it to another AI to design that for you. Canva has the ability to do a presentation for you as well. So you can create the whole presentation in Canva, for example, a topic about telemedicine, for example, you want to talk. So you will give it a prompt to design you the slides. Usually it's a few slides, but you can increase the number of slides. And then you practice on presenting that. It's not a difficult task if you just feel that we are all in the same boat. We are all trying to help each other. It's not like confidence problem or presentation problem. I want you to feel as if you are owning this program. You want to help others, as Dr. Muhammad just did. He showed you how to use the tool. So for him, it may be a new topic, a new tool. He hasn't used it in the past, but he spent some time to learn about it. He tried to use it for himself, and now he is familiar with the basic of it. Now he is able to share it with you and show you how it's done, how he used it for himself. So I think everyone can contribute and can volunteer. So don't hesitate, don't feel shy or feel you are not on top of things. And this goes along for new fellows. This program is designed for everyone, and we contribute. Some of you might have some skills in certain areas, and they need to learn other skills. So whatever you have, share with others, and then the others can teach you the skills that you may need in the future. But thank you so much once again, Dr. Muhammad, and thank you all the presenters. Any comments, any questions? Any other questions about anything about the program? Please raise your hand and introduce yourself and ask your question, or if you want to add any comments or any suggestions. Seniors, or new fellows, please feel free to ask and contribute. I know we have new fellows today, so might not be.
Hello, Dr. Nadir. This is
Oh,
Osman.
go ahead. Go ahead, Dr.
So I'm one of the new candidates here. And I need to know more about the program and what's the next step for me. This is my first day.
Welcome, first of all, Dr. Osman, and welcome all the new fellows. So when I sent you the next step email, it has some steps that I hope you feel free to follow. And the program is structured to help you improve yourself and find the areas that you think you can improve on. So we have some in the app. I'm going to share the app with you. So when you start the app here, the first lines here, you will find some announcement. We have MSU, Michigan State. They have grand round in internal medicine, and they have also grand round in neurology. Usually they do that on Fridays, and the internal medicine grand round on Tuesdays. So you can click on the program and then feel free to investigate if you are interested in any of these. Also, we have a call for abstracts like this conference. They want to have fellows to submit their abstract so that they can present in the conference in the coming months or so. So there are some announcements here you can find. If you go down, you can also see what else you can work on. For example, if you want to apply for next year, you can start working on your CV and your personal statement. We have some documents from previous fellows who matched to programs, and they kindly shared their personal statement and their ERAS application. So instead for you to start from scratch, you can look at what they did in their application and what they wrote in their personal statement, and you can have an idea and you can start building your application slowly, but at least you have a guidance. If you are interested in stats, we have 2 courses. You can click on this and it will show you some options here. You can go slowly, learn from this to either the crash course or the university course, and this will help hopefully some of you. And if you use this app, hopefully it will guide you as the first step. We have a lot of resources here. So the meetings that are coming, you can use this icon to look at them. And if you are interested in certain topics in the future you want to present, you usually click, and let's say next week you want to present some of this topic. So you want to reach out to the leader for that team and tell them, hey, I want to participate in presenting third topic. And then you can put your name. To put your name here, the leader can do that, or you can do that yourself. Like Dr. Fatma was mentioning, she wants to present CKD next week. So she can go here and she goes to first topic. She can put her name as a presenter, and the file will be the first file. So if she goes down, this is the file, this is the link. She can just copy that link and put it in a new browser or new tab, and it will open that file for her. That will be the CKD. Next topic and third topic, for example, someone might want to show us how to use example of AI useful prompts. So maybe one of you can show us that. Sometimes I put some resources done. So you will find some link, like a video link or a website link, or maybe files that can be used. These slides are already made. We call it GRS teaching slides, but some of them you can create your own. So to add yourself, just hit here and put your name, whatever topic, and communicate with leaders so that they know who is presenting and what time, what day. If you want to look at previous Zoom meeting that we had, like last week, we had some of the presenters. These are the topics and the list of presenters. And if you scroll down, you will find the recorded meeting for that day. You can click on it, or you can use see that also on YouTube. If you scroll down, we have other videos collected for you that will help hopefully some of you, and some you can go if you want to explore further, for example, Excel or Google Sheet or presentation or residency or interview skills. So we have some videos. You just click on the videos and watch and see. These are some of the tips, some of them from previous residency applicant or residency program directors. And they share what they look at when they review your application and when they interview you. So maybe you will find some of them useful for you when you are preparing for the interview season, for example, next year. Down there, you will find some other hopefully helpful tool. You can ask for request for a letter of recommendation if needed in the future. But I want you to show me what you did so that when I write the letter of recommendation, it will be personalized to your activity or engagement, your involvement. If you want to start a project, you can start from scratch or you can join a team. If you go here, you will find a list of open projects and the number of fellows who are interested. You can join them. And usually there is a leader for the project and then the team members for the project. So you try to reach out to the leader and then see what task you can help with, and hopefully you will finish the project in time and present it in one of the conferences, or if it's a paper, you can submit to a journal. If it's a mobile application, for example, we can finish it and publish it in one of the stores like Apple Store or Google Store, for example. So these are some of the current projects, research project, but you can add a new project if you're familiar with doing a research project from start, or if you have an idea about a research question. To do that, you just click here and then you can add the details. If you want to join, let's say this project, you go here and you can add yourself and you can specify which role you want to play and what task you want to conduct or to participate in, and then submit. So this is how you do it. You can leave it blank for the role or the task. If you are not interested in a specific area, you can be open and submit for that. And your name will be listed down here along with other fellows. And they have their communication, like their email. Hopefully you can reach out and communicate with each other. You can communicate using WhatsApp as well. So this is how you get involved in a research project. The idea is to cover all items in this list. So we want you to know the principles of like the ethical principles of doing a research project, how to start with a research question, how to build your study design, and then go on and collecting the data and presenting the data and so on. So these are some of the basics we want you to, at the end of the year or your engagement here, we want you to be familiar with these steps, and hopefully it will help you in the future if you are interested in research. So this is the list of the applicants or the fellows who were in this program, and they matched to either residency or fellowship in the US. On the menu here, we have other tools or resources that you can use. For example, if you want to reach to a senior, you can see the list of seniors in this program, or the new fellows will be listed here. We have a dentist group. So if you are a new and a dentist or dental graduate, you can reach out to your fellows as well. This is a list of matched fellows. If you are interested in a specific area, like family medicine or pediatric or neurology, you can see the group listed by specialist, by specialty. If you want to reach your leader in your team, this is a list of team leaders. If you want to communicate with fellows in the area where you are, because some of you might be in the US, but others might be in the Gulf area in India, Pakistan, or Ireland, for example. So you can go by country and reach out to people on the same location, geographical location, or time zone, for example. These are abstracts that were submitted in the past, and this is like a winner display for you to see how people can win these prizes in these conferences. These are the slides we were talking about. If you want to present a topic in geriatric medicine, we have already made slides. So you just go present. If you want to put some extra effort, you can update these slides because these were made a few years ago. Things might change, for example, recommendations or guidelines. So if you have an update version, that would be helpful to us. You can use any resources available online. You can have some slides already made in the past by other university professor, for example, or use YouTube videos like the one we just did during the dizziness topic today. So this is just to go over the app. If you want to browse the app, that would be great. It will just give you an idea. And every day when you have a couple of minutes, maybe you can listen or watch some of the videos that are available here. The program itself, it's designed, I'm gonna stop sharing. So the program designed on the self-paced approach. So you learn by yourself at the time that you decide, but we want to divide you into small groups. It's a big program. So each team will compose of 15 to 20 fellows, and you will have a leader for that team. And you communicate with the leader. Some of you are planning to take step 2 or step 3. So I assume they will, some of you will be busy preparing. So you might not be able to engage all the way with this program. We understand that. But you need to communicate that with your team leader. So when you are done with the exam, then you can contribute, for example, presentation or getting into the projects and so on. The leader will know which one is available, which one will be busy. So when I communicate with the leader, they can tell me I have this and this available. Mostly we want you to work on presentation in this program, but you can contribute as you see fit in the future. In the past, we had some of the fellows participate by doing a mock interview. So you can be a program director, another one present as an applicant for a program. So you can do that as well. Also, in the past, we had some of the fellows created a webinar. So there is a video of how to start a webinar from the idea until you finish. So if you have an educational idea or project you want to teach some community here in the US or abroad, then maybe you can have some of the fellows help you create a webinar, and then we can help you get that done. Some of the fellows in the past also developed mobile applications. So you can also, if you have some idea or you have technology background, maybe you can help develop that. If you don't, you can get involved with some of the currently working on like active project in developing some of these mobile applications. So there are a lot of things going on in this program. It depends on how much time you want to spend, and we want you to get engaged. So you can get familiar with the app. You can get in communication with your other fellows, with the seniors. If you have questions, the WhatsApp group, you can use it to ask any questions. The leaders or the seniors can help you with that. If you don't have any answers, maybe you can reach out to me or Dr. Ahmed, and we will be happy to help you as much as we can. The other aspect of the program is the structure of the project-based approach. So we want you to either come up with the idea for your new project, or you get involved in an ongoing project. When we have the project, we have a team for that project. We have a leader for that team. We call it the project manager. And that project manager will divide the task for that project and divide it into the fellows in that team. And then they can work together to accomplish or complete that project and submit it. So we have basically two different approach. The team approach is organizational, for you to know each other and present, and hopefully you volunteer and help others. And the project approach is to get you involved in a certain area where you are interested in, and you can contribute to that project, and hopefully you can get published. You can get involved in more than one project. It's up to you. And you can present in more than one presentation. It's up to you. Each topic during our meeting can be presented by one person, or it can be presented by more than one fellow. So you can feel also free to help us in the future to present. It will help you gain the skills of presenting in front of others, because it's going to be needed when you go to residency, for example. You'll be presenting every week or every 2 weeks, something like that. So if you present in a small or big group in this program, hopefully you will be familiar and you will be at ease when you are asked to present. Just the communication part will be important. Just reach out to the team leader for that day if you are interested in presenting on a specific date. I hope this as an answer to your question, and to all the new fellows to understand the concept of this program, what we require from you, and hopefully what you will get out of this program.
Yeah, thank you so much, Dr. Nadi. This was very helpful. But about the teams, like I will be fixed, like I will have a fixed team assigned for a fixed team, or how it's gonna work, like.
So as I said, we have one organizational approach is you will be in a team. Let's say you are in a red team, we go by colors. So in your team, you will have 10, 15 or whatever number of fellows in that team. You can be the leader for that team. Senior can be leader, or any of the fellows in that team can be the leader for that team. And it's just the communication between you guys. And hopefully when it's your turn to present, like today's team, presenting some of the topics today. So the team leader will assign, hey, can you present this topic? Can you do that? And it will be just between you and the team leader for that presentation, for example, or the date of the meeting. That's one part. The other part is the project team approach. It's totally different from the first one. The first one, we will assign you to a team, and you will communicate with the team leader, with the team members in that color team. The second approach is approach for a project. So let's say you want to get involved in project number 25. So you go to the app, see who is involved in that project, and contact the project leader and say, hey, I'm interested in this project. So you will get involved and you will be asked to do certain tasks in that project. So you will be involved with that group, and that can be changed or can be multiple. So you can be in one group or more than one group. That means you can be in one research project, or you can be in more than one research project. It depends on you and your availability, your time, and your interest. There are different topics. We focus on presenting abstracts in a conference. That's the easiest way, but some of the fellows wrote some manuscript and submitted to journals. That's a different type of project. And as I mentioned, there are other fellows who were interested in developing some mobile applications for patients and education and so on. And there are other involved in webinar. We can go into developing seminars for medical students or for graduates, either dental graduates or medical graduates, for example. So these are topics or research projects. You can get involved in different areas according to what you need, what's your availability. But in the program, we focus on assigning you to a team. That team is career-based, and you will be in that team for hopefully a long time, if that makes sense.
Yeah, that makes sense. Thank you so much, and thank you for having me in this program. And thanks for all the doctors that presented today. It was very helpful and informative presentations.
Thank you so much. Any one of the seniors, you want to share your experience, or you want to add to what I said, or your perspective? And
Hi, this is me again. Actually, I'm here in research since last year, almost like more than 1 year. I learned a lot of stuff that I have no idea about it. And the other thing, being a research fellow helped me to be accepted to the gerontology masters. And this was like really like it's being accepted is not easy, and being a research fellow helped me a lot. And they didn't do a lot of processing, and they consider this is like they consider me eligible because I already have background. And thank you very much, Dr. Nadir, for all the things you are doing for us and for all the fellows.
thank you so much, Dr. Fatma, for sharing this, and congratulations. And I wish you all the best. But thank you for sharing, and hopefully this will help others as well.
You are welcome.
I know
Hello,
some of
Dr.
you.
Nader.
Go ahead. Sorry.
Hello, Dr. Nader. Hello, everyone. My name is Namarig Al-Naim for the new fellows. I'm a senior fellow here, and I would like to welcome all of you to the program. And we are really thrilled that you joined us to the program, and excited to work with you all. And I would like to take a moment to thank Dr. Nader for this great opportunity. And I would like to let you know, like this opportunity, it's really valuable one, and it will help you to grow personally, professionally, and also to build up your CV. So take it, make use of it, and be active and work your best to make achievements and build up your CV. This really helps you, whatever career you wanna pursue. And I would also I want to mention that this program, it's not just about projects and researches, but also about teamwork, collaboration, and an open communication. So I encourage each of you to actively participate and share your ideas and support one another. We're here to learn together and grow together. And success here is not just about individual effort, it's about working as a team. Um, Try to be proactive, ask questions, and never hesitate to reach out. And once again, welcome and good luck for all of you.
Thank you so much, Dr. Namarik. This is important, and thanks for sharing and highlighting these aspects as well.
Welcome, Dr. Nader.
Any other comments from the seniors or any other questions from the new fellows? Please feel free to go ahead or raise your hand.
Assalamu alaikum, Dr. Nadir. This is Awab. I'm a new fellow too. Most of my questions have been covered by the new other fellow. And actually, you went thoroughly through the whole application and all the parts of the fellowship. But I have one more question. Um, right now, I'm planning um, to get involved in systemic reviews, and I would like to get an idea about how to conduct a systemic review, for example. So in the projects, are there any section for workshops that are specific for research methodology workshops, for example, or systemic review workshops that teach you how to uh, conduct those type of research?
Thank you so much for your question and welcome to the program. I'm going to share the screen again. And if you go to the app and scroll down here, you go to the videos, you can search systematic review, for example. Oops. So we have a lot, not a lot, but we have several videos for you to see how you can do that. So we can go over the introduction. There are tools that you can use. One of them is Rayan, for example. And there is a Prisma of how you go step by step. So these are the basics that you can see, 7 steps for systematic review, if I can answer your question right. And we have some videos when we have our meeting, we talked about some of the systematic review here. And that goes along with any topics or how you do things. For example, how to write a letter to the editor, how to start a webinar. So if you go to the videos, hopefully you will find some of the questions more or less answered in this list of videos that we have. Otherwise, you can go through the internet. You have the AI nowadays, so you can ask how to develop a systematic review. For example, if you have a topic in particular or in general. So if you just want to learn the steps, the AI can outline the steps for you. Then each step you can ask them to elaborate, can ask them to give an example, can ask them to reach out or get out some of the tools for that step. So you can achieve that by yourself. You can learn using the AI tool as a teacher, or you can browse the videos or the resources that we have here, if I answer your question, if that's clear. Thank you.
Yeah, that's clear. Thank you so much, Dr. Nadir.
Any other comments, questions, addition, either from the seniors in this program or the junior and the new fellows?
Hello, it's me. I'm Muhayyad Ahmed. Thank you, Dr. Nadir, for giving me this opportunity. I'm one of the new fellows today. This is my first day here.
Welcome, Dr. Mayat. And one of the things we do in this program is to start this Zoom meeting on Saturdays. And usually the agenda will have like, let's say 4 items, maybe 5, maybe 3. But the main one will be educational. We focus on geriatric, but we can touch base on other subjects as mentioned. So the first topic will be like education, like today about the dizziness and so forth. So hopefully it will help you as far as educational. The second part, sometimes we use some of the tools that are useful in your career, as Dr. Muhammad showed us some of the tutorial how to design, use Canva. Sometimes we touch base on the basics of the research tools, like how to do certain things while you are doing your research. For example, we talked about Ryan or how to analyze the data, how to get graph done, and so on. So the statistic method, that's another way of doing things. So that might be the third topic. The fourth topic, sometimes we focus on how we can improve your personal skills, whether it's like today's topic about how to handle stress or stressful situation when you are resident, how to present, like how to be confident, how to be a leader, like if you want to become a team leader, what the steps, what it takes, and how to become that leader, and so on. So these are the basic of our meetings, and hopefully you can contribute to that, and hopefully you can learn from that. So we can teach each other some of these things, or we can learn from each other regarding these things. But welcome, Dr. Mayat.
Thank you very much.
Any other comments from the seniors, your experience or your perspective, or any tips you want to share for the new fellows? If not, I'd like to thank you all for joining us today in this meeting. Dr. Hyam, thank you so much, and thank you all the presenters from today. And I'd like to thank all the people who will come and look at the recording later on in the future. Thank you in advance, and I wish you all the best. Please don't hesitate to contact us if you have questions or any comments, suggestions. Have a wonderful day, and see you next week. Assalamu alaikum. Dr. Hyam, if you want to add anything, thank you. Go ahead.
Thank you very much, Dr. Nadir, for all support for me. Thank you all presenters for nice topics that and thanks you all the followers. Thank you very much. Good night.
Thank you.
Thank you once again.